Hello everyone, I'm Corinne. Firstly, thank you to each of you for showing up today to be a part of this really important conversation. Thank you also to the staff at Aneurin Bevan University Health Board that have worked really hard to make this campaign happen and to bring us all together today. And also the amazing UK Sepsis Trust who work tirelessly to support us all. Today, Dylan's dad Laurence will be sharing with you our beloved 9-year-old son Dylan's experience of sepsis, including some of the key events leading to his tragic death in December 22, caused by a perforated appendix, just days after being referred to hospital by the GP following a week of intermittent illness. Laurence and I will both share how sepsis has affected us personally, and I'll share how I've used some of the key things I learned from Dylan's tragedy to help drive change, working alongside Aneurin Bevan University Health Board and the UK Sepsis Trust to help lead a sepsis awareness campaign. I'll finish with a call to action, as for me this feels a natural progression for following tragedies like Dylan's and sadly many others, not just within Wales but throughout the UK. Before we begin, a reminder that Dylan's sepsis story was just a few days of his 9 years of life, and prior to this Dylan lived a happy, healthy life and was loved beyond measure. If love alone could have saved him, he would have lived forever.
I'm Laurence, Dylan's dad. Dylan had a week of on and off illness during a busy NHS period right in the middle of a strep A outbreak. After a frightening episode of tummy pain and vomiting, I took him to the GP, and due to lower right pain and guarding in his tummy area, she suspected appendicitis and referred us to the Children's A&E at the Grange University Hospital. At the hospital, Dylan waited for hours on a hard chair in pain before being seen by several clinicians. He was examined, given Nurofen, Calpol and tests were undertaken. It was concluded Dylan had tested positive for flu and that his tummy pain was attributed to this, often called mesenteric adenitis. Another person I believed at the time to be a surgeon or someone of seniority came in to discuss Dylan and reassured me it was flu and not appendicitis. He was very confident and calm, and I trusted his diagnosis after our discussion. I made sure to inform all the staff that reviewed Dylan that night his prior symptoms were that he was referred by the GP due to suspected appendicitis. Dylan was discharged in the early hours of the following morning with advice to keep him hydrated, make sure he urinates twice a day, continue to give Calpol and Nurofen, and that he should get better in approximately 4 days. Dylan remained the same level of unwell at home, watching TV on the sofa for a few days, but then didn't get better, but worse. So I called the hospital open access number for advice to update them on Dylan and confirm the next steps. The nurse told me that children with flu often feel really rough before getting better, to continue with Calpol and keep hydrated, and that A&E was still very busy, and she told me more than once to persist with 111. This reassured me, and I thought I followed the advice and eventually got through to 111 after a huge delay, as I didn't know at the time that they had incorrect estimated wait time set. When 111 finally answered, more errors happened. My concerns were recorded incorrectly, symptoms were double checked with a clinician but still misinterpreted, and I was eventually told to wait for a doctor callback unless Dylan deteriorated further. While awaiting the advice callback, Dylan rapidly worsened, so I rushed him back to the hospital myself. He was treated quickly for overwhelming sepsis caused by a perforated appendix and transferred 4 hours later to another hospital for surgery and intensive care. Dylan was on life support for 4 days, and during this time he had cardiac arrests, developed multi-organ failure and had surgery on his legs, and we were then told they would both need to be amputated. I later learned of all the mistakes and missed opportunities that Dylan slipped through that could have saved his life, including the GP referral for suspected appendicitis was on the system and printed but not read. There was miscommunication between staff regarding a senior review of Dylan. No clear documentation followed. Reassurance and the instruction to discharge were apparently given to discharging staff by a doctor, but this person has never been identified. Security was lax, with a known practice of staff tailgating through barriers. Patient notes were often put in the wrong place. Discharge paperwork was prepared preemptively in the past tense, but the person whose login was used to do it didn't remember doing so. It was later believed to have been handed over as instruction to discharge. Reviews and treatment plans weren't properly documented. Dylan's final observations indicated admission, but this was ignored. The independent expert found inadequate examination and misunderstanding of one of the manual appendicitis tests undertaken. Discharge paperwork wasn't read and safety net advice was incomplete, delaying reattendance. NHS 111 automated phone system gave way under estimated wait times. Parental concerns weren't acted on at the first visit on open access or 111. NHS 111 failed to transfer to ambulance dispatch even though Dylan's symptoms meant they should have. On reattendance, sepsis treatment was fast but suboptimal, likely causing repeated cardiac arrests and further reducing Dylan's chances of survival. Losing Dylan has devastated our lives. Sepsis stole our son and left us broken. Life and work have been incredibly hard since losing him. Simple tasks can feel impossible. I struggle with depression, anxiety, and often withdraw from the world. I continue to see a therapist and take medication trying to cope, but the pain never fully goes away.
We were told he may still be able to hear us, and we were in complete shock and fear that he might not pull through, and also that he might be experiencing distress, because we learned, despite being unconscious and ventilated, some people do experience great distress. So we spent those final days trying to reassure him, stroking his hair, singing songs to him, telling him to think of his favourite memories, like going down the water slides at Centre Parks, coding on his computer, riding his bike. He'd been reading the How to Train Your Dragon books and was on the final one in the series, so I read many chapters to him, and I eventually came to the final chapter, and every time I did, I just couldn't finish it. It just felt so final. So I'd go back and start again previous chapters until we heard the words that no parent ever wants to hear, that sepsis had proved overwhelming and there was nothing further they could do for him. And this is where Dylan's story ends for him, because care was withdrawn and Dylan died on the 14th of December 2022. I theoretically died along with Dylan on that day. It goes without saying that losing such a young, endearing child to a preventable death, after reassuring him doctors were going to make him better and everything was going to be okay, is a haunting life sentence of pain and wonder. Facing every day without Dylan is torturous, and I relive his final moments daily with images of his scared little eyes looking up at me, his helpless little body being perished by sepsis, and of him taking his final breaths burned into my memory. Dylan was such an endearing, unique and loving boy, and the final little person to complete our family, my whole reason for being. I could survive anything life threw at me, but not this. As a mother, discovering your child's death was preventable is an added torturous layer to navigate. What if I pushed harder? If only I shouted louder? What if Dylan hadn't slipped through the net? If only we were pre-armed with specific sepsis information and told that Dylan could be experiencing a condition leaving him at significant risk of sepsis. And this is where my sepsis story evolves. I know others will resonate with these feelings of what if only, and feelings of blame, and to a degree they are completely understandable, but they're rarely productive. Whether you're a healthcare professional, a harmed patient, or a bereaved loved one, we all would have acted differently had we have known at the time what the outcome was going to be. After Dylan died, we wanted to know as much as we could about what had happened so that we could try and comprehend it. I spent time educating myself, asking questions, and learned over time that many things had gone wrong in those final days for Dylan leading up to his death, and that his death was preventable. Understanding what went wrong can be really helpful with future sepsis prevention and care. I learned that Dylan's outcome was a result of a perfect storm, a series of things that had all added up, and any number of them, had they have happened differently or not happened at all, could have affected the outcome for Dylan potentially. From the series of things that went wrong for Dylan, here are key things I learned that helped me to drive further improvements. Effective communication between everyone is vital. Everyone has a role to play, from parents to healthcare professionals. Every interaction, action, decision matters because small oversights add up. Commitment to a zero tolerance of unsafe practice avoids harm, saves lives, and can help maintain well-being of staff. Children, unlike adults typically, can compensate when they're really unwell before rapidly deteriorating. This underscores to me the importance of having robust safeguards in place to help prevent things like unsafe deviations from standard procedure, particularly when staff are busy. Parent concerns need to be treated as vital clinical information. Parents know their child best, but sometimes a parent raising concern can gain a false sense of reassurance, deterring them from a particular course of action for their unwell child's progressing symptoms. The importance of keeping sepsis in mind, particularly when parents are questioning a diagnosis or expressing worry or seeking further help, can never be overestimated. Sepsis can sometimes be avoidable. Certain conditions like a perforated appendix significantly increases the risk of sepsis, and a complex situation for an emergency and PICU staff to deal with. Dylan's illness turned into a complex situation that could have been avoided. Nothing more anyone can ever do can give Dylan a second chance. His life ended due to sepsis. Part of my sepsis story is one of change, turning my pain into action for all to learn from tragedy and commit to change. A sepsis awareness campaign is really useful and so much more than spreading awareness and having conversations. It's about ingraining a culture, regularly updating and improving education, awareness, training and safe systems, and ensuring that this is all regularly monitored, measured and maintained. It shouldn't take the preventable harm or death of anyone else so others can be spared. When things go terribly wrong for people, phrases like lessons have been learned are hollow unless evidence of meaningful, optimal learning is seen. In summary, my call to action, using some of the key failures for Dylan, is quite simply for an all-Wales consistent approach to sepsis awareness. A year after Dylan's death and after a bit of research, including the amazing work of the UK Sepsis Trust and finding out about some of their pilots working well in England, I drafted a sepsis awareness campaign proposal for Aneurin Bevan. I'm proud to work collaboratively alongside them and the UK Sepsis Trust on this, including the new discharged safety netting leaflets now in place as part of the campaign for both adults and children following GP or hospital review. My long-term aim has always been for Aneurin Bevan to lead the way and then to have it rolled out throughout Wales for consistency. And following communication with Welsh Government, I'm now working to help encourage other health boards within Wales to adopt the same for a consistent all-Wales approach. So if you're listening to this, particularly if you're from another health board outside of Aneurin Bevan or you're an influential person, please chat to any one of us about this and the wider sepsis awareness campaign. Whether you're one of the many healthcare professionals doing amazing work, often under really difficult circumstances, or a member of the public, working together, we can beat sepsis.